Davina Conner is an award-winning advocate, speaker, and founding member of the U equals U campaign. And this is a movement that has become global. It now exists in over 99 countries, with 930 organizations who has joined it. And Davina, you have traveled throughout the United States, speaking to healthcare providers, to policymakers, and to the community about what it means to be a woman living with HIV, and also the impact that U equals U is having on stigma and the quality of life for people living with HIV today. You are, among many, many other things, the former co-chair of Positive Women's Network Colorado, a former member of Denver, Colorado's HIV Planning Council, the 2020 leading Women's Society member of Sister Love, and also the founder of Posthaven Foundation. So she has come all the way from Denver, Colorado to speak about U equals U, both the movement and the message. So the stage is yours.
You.
Thank you.
Hello. First, I want to say that it's an honor to be here all the way from the United States. I've never been to Sweden before. So I want to talk to you guys a little bit about who I am first and the journey that led me here to Sweden. So I was diagnosed with HIV 22 years ago. And at that time, I was 27 years old, and I had a daughter who was 6. And just being in that space in the doctor's office, getting that diagnosis is very emotional still today. You have a lot of different thoughts in your head when you're first diagnosed. You don't know what to do. You don't know how it happened. So those were a lot of questions. But the only question that I had for myself was, am I going to die? And who's going to take care of my daughter? There was never any questions of who's going to love me? Will I ever be in a relationship? I think being a mother, my only concern was always my daughter in the beginning. So I ended up falling into a very, very deep depression. And I left my daughter to be cared for by my sister because I was afraid that she would contract HIV from me because I had no knowledge about HIV. So I didn't know if she could contract it from me kissing her or from eating off my spoon or from drinking after me. I had no clue whatsoever. So leaving that doctor's office, they gave me no information whatsoever about my diagnosis. I wasn't put into care. I just left there without any knowledge. After about maybe 3 months or so, I realized that this was not the way that I was supposed to live because this is not how I was raised. We were raised to be very strong women. This is how my father raised us. So I called the clinic, looked in the yellow pages, and I got on ARVs. Back then, they called them protease inhibitors. I was very, very sick from the medication. I was taking 14 pills a day, nauseated, my head hurt, I was vomiting a lot, my tongue was numb, my mouth was dry, but I had to get up every single day and still go to work to take care of my daughter. Still this day, when I think about it, I say to myself, I don't even know how I even got through the side effects of the medication because that's how bad they were. I ended up becoming an alcoholic. And that was because I thought that the alcohol was suppressing how the medication was making me feel from the side effects. So I drank very heavily to get rid of the side effects. Mentally, that's what I thought. And I ended up becoming resistant to my HIV medication, which means there was a whole group of medications that I couldn't take anymore. And right then is when I learned that it wasn't going to be HIV that was going to take my life. I was going to do it myself from not taking the medication the way that I needed to. So being diagnosed with HIV, I think a lot of people who are not diagnosed with HIV don't really understand what someone goes through mentally when they're diagnosed. So it's the stigma, the internal stigma. You're always worried about what somebody thinks of you or how they see you. So you don't want to disclose because it's that fear of what other people think and how they see you. So I always tell people I started my advocacy because of the stigma. And I started it with a podcast, with an internet radio show, because I wanted people to realize that being diagnosed with HIV was no longer a death sentence. So I had people come onto my show and share their journey of HIV diagnosis so people can understand that people were living long, healthy lives being diagnosed with HIV. So in the midst of me doing this, I learned that I was inspiring and motivating, encouraging more people that were diagnosed with HIV. And that's how my journey just kept leading me to do so. Being diagnosed, we have to realize that the fear that someone else feels about us has nothing to do with us. We can't put their fears on us. We have to learn to view ourselves as any other human being walking around in society. I tell people that I am not infectious. I am not diseased. I'm simply a woman diagnosed with HIV. And I teach people to change the language in how they view people that are diagnosed with HIV. So anyone here who is diagnosed, you have to understand that you are not infectious. You are not diseased. You are simply just a human being. And how I got into U equals U was because I was married for 15 years to a man who was HIV negative. And we had a beautiful baby girl who was not diagnosed with HIV. And she's 18 years old today. I knew then because the doctor that I was dealing with didn't actually tell me, but told me that I could not transmit HIV to my husband. When I met Bruce Richmond at a conference in 2016, and we talked about it, and he asked, why didn't I go about telling other people? You know, you just never thought about it. So Bruce took the initiative to do that, and he reached out to every advocate that he can think of to see if they knew this information. I jumped onto U equals U because I knew that it was the truth. And I knew that if I used my voice and put a face to the voice, that I can change the lives of other people being diagnosed with HIV. And so that's how I started with the U equals U campaign. We'll talk about U equals U now. So the defining moment in history is in 1996, we learned that effective treatment would save our lives. And then today, we are learning that we cannot pass on HIV to our partners. What does U equals U mean? U equals U means undetectable, untransmittable. People living with HIV who are on treatment and have an undetectable viral load cannot transmit HIV to their sexual partners. U equals U is a game changer because it transforms lives. It dismantles HIV stigma. and it reduces anxiety associated with HIV testing and adds an initiative to start and stay on treatment and in care. People diagnosed with HIV, I don't know what's going on. There it goes. Okay, people diagnosed with HIV, I think a lot of us never imagined that we could love, that we can care, that we can be in a relationship. And U equals U has given so many people diagnosed with HIV hope again. It's giving them life again to know that they can't transmit. Just like I said earlier, is how I felt with my daughter because I thought that I was infectious. Conveying these messages to people that are diagnosed with HIV gives them so much hope within themselves. And then it stops the internal stigma that they feel about themselves. So why do we need the U equals U campaign? Most people in the community, except the privileged, do not know about the science of U equals U. And many still do not know about the science today. And that's a lot of reasons why is because many providers don't share this message with everyone. They only choose a particular group that they share this message with. All people with HIV have a right to know and have the acquired information about their social, sexual, and reproductive health. HIV stigma is still a public health emergency. U equals U is an immediate effect of public health solution. We have to get this message out to the communities, not just to people that are diagnosed with HIV, but also to those who are not diagnosed with HIV. So we always tell people, we'll tell the truth or we'll tell it for you. And that's what the group of advocates did. We went around and we told the truth. No matter if it was just talking to someone on the streets, if it was to your providers or a family member or just someone in the community. And I think that if we didn't do this, we wouldn't be where we are today when it comes to U equals U. A lot of people pushed the message away because we were only advocates talking about this message. So bringing science to the people. Bruce Richmond learned when he was diagnosed that he could no longer transmit HIV. And his physician told him this. Bruce Richmond is the one who started the U equals U campaign through Prevention Access. He went to the researchers because his doctor wouldn't put it in writing that he could not transmit. Even though that's what he told him, he wouldn't put it in writing. So he found the researchers that said this. And they took 6 months and worked with Bruce, and they piled up a consensus statement. This consensus statement was put out because the researchers had no idea that this was not getting out to the people. It's like taking a box and putting it in the attic, and then everybody forgets that it's sitting there. And this is what happened when the researchers did this. No one knew about the message. So Bruce went to them, and it took them 6 months, and they put this together. And then after this was put together, he made a video. And these are other advocates that spoke about being undetectable. But this is the first video that came out. After this video was out in 2016, you had Terrence Higgins Trust, who signed on, and the New York City Health Department and the Department of Health and Human Services in the United States also signed on. And then we come to the CDC. Many people put a lot of backlash on the U equals U campaign because they said the CDC did not support it. And I always told them, well, the CDC gets their data from people that are diagnosed with HIV anyway. But a lot of people wanted to wait for the CDC to jump on board before they agreed to U equals U. So the CDC says effectively no risk of sexual transmissions when on treatment and undetectable. They also said U equals U is 100% effective for preventing sexual transmission. U equals U is the foundation of being able to end the epidemic. And I truly believe this. It's going to take U equals U to end the epidemic, and it's also going to take PrEP to end the epidemic. Putting both of those together will end the HIV epidemic. It won't just take one, but it will also take those who are out of care and put back into care. Once they find out that they can no longer transmit, they will get back into care, and it will stop the transmissions of HIV. Then we have I think I passed it. At the USA Conference on AIDS, Dr. Anthony Fauci spoke there, and he says the science really does verify that validates U equals U. And he said this in front of about 4,000 people, and this was in 2017. And she just told you guys that there are 900 organizations, or 930 partners or organizations who have signed on to U equals U. But not only that, they're from 99 countries. Everyone in all these spaces have used their own funds and made flyers and flags, and they made parades and dance parties to let people know in their country, in their city, in their states, in their communities, in their health departments, that they can no longer transmit. So U equals U communication. I'll show you a little bit about how people are communicating the message of U equals U. The next one that's going to come up is Dinah. And Dinah is from the transgender in Europe, transgender chair in Europe. And this is what she said at the US, the AIDS 2018 conference.
Untransmittable, or U is U, message to become standard knowledge worldwide. It needs to sound louder every day, as this eases the burden of stigma and self-stigma of people living with HIV. It will save lives. It will reduce suicides and murders on trans sex workers especially.
These are other messages that are being conveyed through different organizations. Up here is the mayor in DC signing on to the U equals U. This is Uganda here. And this is a dance party at one of the United States Conference on AIDS. And I think this is another one from Uganda. I'm not exactly sure about that one, but this is just a lot of the things that the people are doing to convey the messages of U equals U. And then that's me right there on the streets of Denver talking to somebody about U equals U. We have Japan, France, Guatemala, Canada, Spain, Indonesia. So all of these individuals got together with their organizations and they made their own message of U equals U the best way that they can. And they're conveying it still today in their communities, in their countries.
U equals U is important to me because I can have a relationship, I can have children, and also build on my future.
U equals U is important because we can give people hope. When they came to the clinic, they are not afraid that much because they know that if they take a treatment, they can live like anyone else.
The reason why I'm going to join the march is that I want to dismantle stigma among people living with HIV and promoting U equals U so that everyone can understand the real meaning of it.
You equals you message is important for me. It's because this is the scientific fact, and this fact should be shouted out through the crowds. And also I believe that spreading this message to every society, every people in the world will give us the strength to fight with the epidemic.
The U equals you message is so important for me because it's such a strong, powerful, empowering message. If you're undetectable, you cannot transmit the virus anymore to another person. It's such a liberating message, and I want to bring that message all around the world. Everybody has to know about this message.
That's one of my favorite videos. Then in Japan, they did a U equals U dance party, and then they made a U equals U song up here. This is a U equals U song. And again, the mayor of DC, and they also have the information on the buses now while they're riding up and down the street.
As prevention approach
in DC.
And we should all be proud of this progress, but we should double down on our efforts as well. Today, DC becomes one of the first cities in the nation to support new HIV strategy called U equals U, which stands for Undetectable equals Untransmittable. And through this strategy, we're working to ensure that all residents living with HIV take their medications on a consistent basis. This daily routine will suppress the virus until it becomes undetectable. When that happens, a person living with HIV will not transmit the virus. People living with HIV have long borne the brunt of stigma associated with this disease. And now we will continue to work to make sure that they are empowered.
And again, this is the IAS in 2017 in Paris, France, and they were speaking about U equals U there too in 2017. And then Venezuela, they're talking about it. It's I equals I. Every country has their different way that they convey U equals U. And this is, again, you couldn't hear it earlier, so I'm glad you can hear it this time. This is in Zimbabwe. I mean, in Zambia, sorry. So just the different ways that people are getting the message out in music and song and dance, just to let people know that we can no longer transmit HIV. And then you have UNAIDS and the World Health Organization, and these are just some more of the individuals or the organizations, what they put together to show how they use the messages of U equals U. We have England, Canada, Vietnam, Zimbabwe, Zambia, Brazil, Australia, and the biggest one was Terence Higgin and Trust in the UK. They were the start in another country who just constantly, always made different messages to get the word out on social media. I mean, every time you turned around, Terence Higgin and Trust was putting something up that had to do with U equals U. And they did this before the United States even did it. And then in Hong Kong, they made a U equals U modeling show. That's what this was. The whole show was about U equals U, but it was a modeling show. And then in New York City, this is what they have out there in New York City, conveying the messages of U equals U. And then we have two superstars, I guess, if that's what you want to call them. This one, he just came on TV just about a month or so ago and started talking about U equals U and how he was diagnosed with HIV. And it is so now you have individuals on television, on the news channels speaking about U equals U. And so that just made all of us that are advocating towards U equals U, it made us so happy that this is now coming out on TV and more people are learning about it. The next slide is one of the first campaigns in the United States that talks about U equals U. It was a campaign called Positive Series, and they took 4 advocates and they took their journeys or their HIV stories and they made virtual characters out of them. And you can use those by going to the website and putting it in the language that you want and then playing it for people so they can see how somebody can no longer transmit. You can also download the posters from there and put your own organization's name on it and use it in your organization or your facility to talk about U equals U and put it on the walls. And that's my virtual character. And I'm just going to show you a few things that I've done to convey the messages of U equals U. I walk the streets of Denver and I let people know that I'm diagnosed with HIV. And I ask them, is it okay that I film them? And this is just one of the ones that I filmed talking about.
I told you earlier, I've been living with HIV for 20 years. People are living longer being diagnosed with HIV. I know people that have been living for 35 years being diagnosed with HIV. There's something else that's going around now, and it's called U equals U. It's a campaign. Okay. And what it is U equals U means undetectable, untransmittable. And what happens is, if you are diagnosed with HIV and you take your medication, you become virally suppressed, which means your viral load, you're undetectable. You cannot transmit HIV.
Nice.
So a lot of people are living longer. I was married to a man that was negative. I had a baby. My baby girl, 16.
And this is another that I've done. This is called Driving Out Stigma, and I put this on the back of my car, and I ride through Denver, Colorado like this with magnets on my car so people can know about U equals U message.
And this right here is my favorite. It says people diagnosed with HIV cannot transmit as long as they are on effective treatment. Did you know? You know, U equals U. Undetectable, untransmittable. I tell you guys all the time, U equals U is my life. This is going to get people to talk, to ask questions while I'm driving, if I'm driving Lyft. But I would be driving my car around Denver with these magnets on.
And this is something, these are just different things that I've done to convey the messages of U equals U. I started a little dance party on social media and had people email me videos, and I put the same music to each video, and I asked them what they wanted me to say, and I put it on the videos and I put it up. So I'll just show you one because it's going to be too loud. So I think we can just show the first one, which is Charles, another advocate. If it can come up. Let's see.
Oh, yeah.
It makes you smile. So I just told them to send it in and tell me how U equals U makes them feel, and we just shared them all on social media. I don't want to play all of them, so. Okay. U equals U is a public health argument. Investing in the well-being of people with HIV is the most effective way to save lives and end the HIV epidemic. Effective treatment, care, and services. One, it greatly improves the well-being of people living with HIV, and it also eliminates new HIV transmissions. Viral load does not equal value. Not everyone will have an undetectable viral load. And a lot of people always say they don't want to talk about U equals U because they're afraid that they're going to hurt people that don't have an undetectable viral load. We have to keep conveying and talking about U equals U and letting those know that that cannot reach an undetectable viral load, that they still need to stay on their meds, because being on their meds is going to keep them healthy and they'll still live a long life. So just because someone cannot reach undetectable levels, it doesn't mean you can't encourage them to stay on their meds, because they can still live a long life. Now, this one here is the partner study. So in 2008 and 2016, there were 0 transmissions linked to HIV. There were over 100,000 condomless sex acts, and not one person contracted HIV. 0 links to HIV with these sex acts. So the U equals U providers talk about, let's see, I can get it on. The doctor here, Sarah, she talked about how it is inexcusable. There is no reason why doctors should not be telling people diagnosed with HIV that they are undetectable, that they cannot transmit. This is a health emergency. You can't keep this from people that are diagnosed with HIV. It's not right. We have a right to know about our sexual and reproductive health, regardless of how our physicians feel or anyone else. This is our right to know. It's making a lot of people diagnosed with HIV very angry because they didn't know. And so then in turn with their providers, they're not trusting their providers now because their providers didn't tell them this. So we have to educate all patients on U equals U and those in the community who are not diagnosed with HIV. And I know it sounds like I keep repeating the same thing, but this is just, it's what it is. We have to just keep talking about it. Telling someone they are infectious when they are not infectious, it is unethical and harmful to them. It is malpractice to withhold critical, well-accepted, science-based health information to people with HIV. Patients will find out elsewhere, and breaking the trust, like I said, breaking trust between providers and patients. So it's the basics is treatments, labs, and connection. So U equals U is about sex. It's not about breastfeeding. They haven't gotten that far yet. And then U equals U only prevents HIV. It doesn't prevent STDs. HIV discloses laws. U equals U might not be an exemption for that. So viral load does not equal value. It doesn't mean you're more valuable than the other person who cannot reach an undetectable viral load. Anthony Fauci, he talks about how there is 0 risk. And then he says, if we can get people to undetectable, not only do we save the life of that person, we make it, in fact, impossible for that person to transmit. I keep saying these words the way that I'm saying them. The 0 risk, impossible risk, cannot transmit. We have Dr. Diffenbach says your chance of acquiring HIV from that person, again, 0. Let's be clear about that. And then he says it again, 0. And I keep repeating this because a lot of us diagnosed have to keep repeating this to ourselves, to remind ourselves. And that's what I had to do. All of us have to keep doing this because we have to know that we are not infectious. Again, no risk, 0 risk of transmissions of HIV. So avoiding terms like minimal risk or may transmit, it's just 0. It's always 0. So being overly cautious attitudes have profound impacts. So the big eraser is don't say, I believe in U equals U, but use a condom or PrEP just in case. Again, this is for us who are diagnosed to know that we can have long, loving relationships with our partners. We're not conveying condomless sex just to go out and have sex with anyone. It's for us and our partners. So again, say condoms or PrEP aren't clinically necessary to use. You can say that. It's up to them to use them, though. And you might want to use a condom or PrEP. You can say you might want to use it, but don't let them think that they have to use it because they may transmit. We just keep trying to convey to let people know that we cannot transmit. So over the cautious attitudes have profound impact. This is another one. Don't say you're only as good as your last viral load. Say if you're taking your medications as prescribed, getting your labs done regularly, and stay connected to care, you don't worry. You just don't have to worry as long as we stay on our medication. And you don't say you never know. We say you do. People need to see and hear and practice U equals U repeatedly to come and to accept it. And that's why I keep repeating these same words. We have to constantly repeat it. And we have to use these conversations about U equals U with HIV and those undiagnosed. You know, even when you're testing someone, you can talk about U equals U while you're testing them, just in case they come back with a positive test. Then they'll know that they need to get on medication because they can live a life and become undetectable. So this again, this is going to be talking about the way we convey it again in the language that we use, like saying we can't pass it on, but then say we greatly reduces. So just saying we can't transmit, there's no risk, zero risk, prevents HIV, eliminates onward transmission, and effectively no risk. So please don't say greatly reduces or extremely unlikely or close to zero, because it's not close to zero. It's actually zero. Again, zero. And then we have Lancet and Jama. All these are from medical journals who have signed on to U equals U. And I'll read Lancet. It says U equals U is simple but hugely important campaign based on a solid foundation of scientific evidence. We have to know that we have to believe in the science. So you have to believe in the science. There's just no other way to put it. That's the only way that I can explain it, because everybody believes in science. So why wouldn't you believe in U equals U? I have an advocate that always says, the same doctor that told you you were diagnosed with HIV is the same doctor that is telling you you can no longer transmit. And then again, these are more of different newspapers and organizations and magazines that have signed on and talks about U equals U. The Washington Post says U equals U is the campaign credited with beginning to change the public perception of HIV transmissibility. So that's a great right there. That's great. So to join the communication in U equals U, you would train all of your staff on the U equals U communication, and you would communicate clearly about it. So you require grantees to communicate U equals U in communications and in their advocacy work. Conduct media outreach on U equals U. And speak about it. Speak out. Speak loudly about U equals U. You don't have to let people know that you're diagnosed with HIV to talk about U equals U. And I always let people know that you don't have to. If you are diagnosed, you don't have to out your status to talk about U equals U. You're just letting somebody know about some information that you learned about. And so the next one will be, these are the ambassadors of U equals U. And they just started the ambassadors program. And I'm going to show you at USCA 3 advocates that talked about how U equals U made them feel. The first one is me. U equals U means hope to me. Hope for life, hope for love, hope for happiness. And it has changed my life immensely because I can share this message with others who feel lost, scared, or infectious. They too can feel that life is new to them again. Being able to know 100% that I can't transmit and be free from guilt that had lost me. U equals U has taught me to stand up and be a strong voice for those in the community. And then the other one is Mariah. She went through a lot being diagnosed, and this is just part of it. I just did little clips.
And it was then that I found out I couldn't transmit HIV. And I did 3 things, right? I cried. This was the moment that years of stigma and shame and fear dissolved in an instant. It was the moment I truly accepted my status. Secondly, I got mad. Why didn't my healthcare provider tell me this life-changing information? And thirdly, and most importantly, I downloaded a dating app. So, so I remember going on dates with this folder of printed study results and the Swiss statement because there was no website back then. And I don't know about y'all, but for me, confidence intervals are not exactly like the sexiest date night topic. But it did work out for me. I've been married to my husband who chose science over stigma since 2015.
And this is Aline.
Later on, when I found out about the U equals U message, it gave me encouragement to go on and do what I needed to do for myself, to stay on my meds. I know that I could not hurt anyone. I think it's a great disservice that people do not educate themselves on U equals U. I think it's a great disservice that healthcare providers do to us, people living with HIV, thinking that we're too stupid to handle information.
So this is how a lot of people diagnosed are feeling. And it's not just the 3 videos that you saw. People diagnosed with HIV are frustrated because their providers, no one told them this. Again, we have to we have to give people hope. We need to give people hope that are diagnosed with HIV so they can know that they can live a healthy, happy life. This is a video that was at the AIDS 2018, and Allison at the conference says this.
Oh, it looks like we've got one more, and it has to come from U equals U himself.
Hi, Allison. Today is marking a revolution in what it means to live with HIV. So, thank you so much for your research. I have a question on behalf of the U equals U campaign. There are many providers that are still not accepting this message. They try to focus on the risk is not zero scientifically, or they focus on their patients aren't going to be adherent and they won't know that they're detectable, or they say there's a rise of STIs already, so they don't want to share this with their patients. We get every single kind of excuse. What would you say to clinicians or any other information provider who is withholding this information from people with HIV?
Yeah, and I just want to pay tribute to the U equals U campaign. It's been astonishing. I think the time for excuses are over. I think it's very, very clear that the risk is zero. So I very much think we have to promote this. I think if you're on suppressive ART, you're sexually non-infectious, and yeah, the time for excuses is over. And I again pay tribute to you and your work. Thank you.
Well said. Thank you, Alison. Great.
Okay. Now, if anybody has any questions, I'll answer them the best of my ability. That one question? One?
I have a question. What about the poor countries where they can't afford medicines? What should we do about them?
You said the individuals who can't afford the medication. Yes. I don't know how it works here in Sweden. I know in the US they have a lot of programs that people can get on. So I always say there's no excuse for someone in the US not to be on medication, because there's so many different ways that people can get on medication there. They have Ryan White. They have the ADAP, which is AIDS, a drug assistant program. I don't know how that works here in...
It's free in Sweden. I mean other countries, like poor countries.
Yeah, see, and my husband's from Nigeria. Yeah. They have a tough time getting on meds there. They can get on the meds, but sometimes they have to go so far just to get them. So he used to go 8 hours just to get on his med, just to get treatment. It can happen, but it's tough in a lot of other countries.
My question would be about the stigma. How can we use the U equal U to get down to zero stigma? Because stigma is the problem, not the U.
Stigma is U. It is the problem. Stigma is the problem. HIV, it's the stigma that's killing people, basically. It's not the HIV. And because of the stigma, it's stopping people from even wanting to get treatment because they don't want somebody to find out that they're diagnosed. That is a really hard one. And I always say to people that I can only tell them what I've done, but I can't tell them that they have to do it. I only can tell them what I've done to stop the internal stigma within myself. So yeah, that's a really tough one, because I work with a lot of people. I mentor over the phone to try to help people get over the stigma. There are some that I'm still talking to today after 3 years, and it won't click, you know. And then other people, it clicks right away. So I just say, just don't let the fear of other people be put on you. You have to have confidence and believe in who you are as a human being, and not worry about what other people think. I always say, your family you may lose your family, but your family is not going to work for you. They're not taking care of your children. So I always say, why does it matter that someone else makes you feel that way? Get into a HIV community, and then you make a new family. So that's what a lot of us have done. We've made new families within the HIV community. That's a tough one, though.
So, is it more difficult to run the campaign nowadays because of, well, the national politicians that are a bit weird and fake news and all that?
You said, is it hard to run the campaign because the U equals U campaign?
Yeah, you know, fake news and weird presidents and all that.
No, we haven't had any trouble so far. Like I had told you guys, you know, you have a lot of the stars now that are coming out with their HIV status, and they're talking about U equals U. And again, I really thank Bruce Richmond for what he's done to get this message out and reaching out to all these advocates, because now it's going towards stars and singers and people on TV now talking about it. And a lot of them don't even know how it started, but at least the message is out there.
can hear anything, but in the previous presentations today, we've talked a lot about the information policy that we have in Sweden, the obligation that you need to tell your sexual partners beforehand of your status. What's the current situation in the US today?
You still have to tell people that you're diagnosed. Because of HIV criminalization laws, U equals U they don't use it in the US, not now. I know there has been a couple of, I know of one criminalization case where a young man almost went to jail, and they talked about U equals U because he was undetectable, and the guy did not transmit HIV from him. So he ended up getting off, but they don't use it in the US like they do here. It's not used at all, not yet. So we'll get there.
It's changing, you think?
Yeah, we'll get there.
Okay.
My question is, you bring message to us here, but there's a poor country who doesn't have enough knowledge. They don't speak about HIV. They know if someone in the family you are sick, or people they don't want to come. They think just to be close to you, you'll get. So those people doesn't have enough knowledge. How you are planning to give them message, which one you give to us?
Again, there are other countries in Africa that are talking about U equals U. I know in some parts they know nothing about it. They hear about it, but they don't know if it's the truth. So gradually, I think that we'll be working on, I know we'll be working on other countries. I think Bruce said right now they're working with someone in Nigeria, and soon I hope that I'm there and I'll be able to convey the messages of U equals U there. People are doing this on their own. So I think people forget that they think that this is one organization that is helping everyone, but everybody is doing this on their own to get the message out with their own funds. Just like Prevention Access Campaign that started it. It's a small organization with only 2 people, and they didn't have the funds, so that's how they ended up conveying it, by telling other advocates, and everybody used their own funds in the way that they needed to get the message out. So in other countries, I think that we'll get there too eventually. Like I said, there are countries there are places in Africa that are doing it now. It's just going to take some time. But I understand that a lot of people can't be open with their status because no one will come around them in a lot of parts of Africa. It's really hard. Very, very hard.
Okay, I think we're done with questions. So thank you so much, Davina. It has been an honor, and some flowers.